Healthcare access and affordability continues to be a monumental problem for a lot of people in the United States. Not too long ago, I talked to a gentleman who works for a trucking company, and he and his family are insured. But a couple of years ago, his wife suffered a major health care crisis, and in spite of the fact that they were insured, he told me that the medical bills were outrageous. They were so outrageous, in fact, that his family was forced into bankruptcy. This is in spite of developments such as the Affordable Care Act, also known as Obamacare. Then, of course, there are a lot of people who were not covered at all because the Supreme Court ruled that states could not be required to expand their Medicaid programs, and so they were effectively locked out of Obamacare. And then you have the issue of people who are insured but still have trouble under Obamacare paying for medical treatment because of high deductibles and copays. There's not a lot of hope for this situation getting better in the United States anytime soon. The state of political polarization that exists simply doesn't allow for it. The political divide is too great. So health care will continue to be a huge issue for many people in years to come. So I wanted to talk to you just a little bit about health care options for low-income people and otherwise economically distressed people, because there are a few options out there of which people may not be aware. And I wanted to tell you a little bit about what they are. First of all, there are hospital emergency rooms. Federal law in the United States requires that hospitals, most hospitals that is, provide stabilizing treatment to anybody who comes through their doors. So you can get stabilizing treatment. Is the treatment limited? I would say yes, it is. I would say that hospitals make efforts to minimize their cost when uninsured people come in the door, and you can't be sure, I would say anyway, of the same quality of care if you are uninsured. Plus, there is also the problem that people who use hospital emergency rooms, even though they may get treatment, they are then confronted with huge medical bills from the hospital and from other places that they're not going to be able to pay. Now, this can force people into bankruptcy if they're not in a low-income category. But what if you are low income? Well, then I would suggest, as soon as you get that bill, if you're a low-income person or a low-income household, I would recommend getting proof of income together and sending that with a copy of your bill back to the hospital. And you may want to send copies to several places. You may want to send it to the hospital administration, the people who are handling the billing, and several other places, and just prove your income. And it may be that if they see that they're never going to get that money out of you, they may let it go. I think there are some tax advantages to letting it go. So remember that. If you have a huge hospital bill that you can't pay and you're never going to be able to pay, then work up proof of income and send that to them. That may help you. If it doesn't help you because your income is at a level that's not considered really low income, then you may in fact be forced into bankruptcy. And once they start making legal threats, it would be a good idea to consult a bankruptcy attorney. That's a crying shame, but a lot of people are forced into bankruptcy. But remember this, use hospital emergency rooms, be able to provide proof of your income should they start challenging you with these huge bills. And I have some experience in this regard. In December 2002, I had been laid off from my job with a telecommunications company. I was living in Bessemer, Alabama at that time, and I contracted a serious infectious disease, bacterial meningitis, an almost deadly disease. It was a near-death experience for me. The hospital bills for my treatment, and since I was close to dying, they did pull out all the stops to try to save me, and fortunately it did work. There may have been some divine intervention involved too, but I did get all of the treatment that I needed. And I mentioned to one of the people, well, I don't have any insurance, and he told me, well, Dr. Livingston and I don't really care about that. We just want to help people. So you do find those people who are willing to try to help, even though you may not be insured. But I provided people at the hospital at that time, and some other medical providers as well, proof of my income, and that $60,000 hospital bill was written off. That happens sometimes. So be willing and able and do your best to provide your income if you get a huge hospital bill. There's another option that people may not know about that they should know about. All across the United States, there are these organizations known as community health centers. These are organizations that typically receive a lot of grant money from the federal government. It's an outgrowth of the Great Society or the War on Poverty, and amazingly, it still exists after all these years and after going through Republican administrations and Republican Congresses. It still exists. Community health centers. They treat low-income people on a sliding scale. The amount you pay depends on your income, and co-payments have been as low as $20 a person for a medical visit. To see a doctor, you could see a doctor for $20 a visit, and that depends on your income. So to access these services, you'll need to provide proof of income and see where you fit on the sliding scale. Now, the kinds of treatment that are available with community health centers, I would say basically they do exams, they do tests, and they write prescriptions. So whatever your problem is, if you go to a community health center, the treatment that more than likely that's going to be available to you is prescription medication. And some of these places also have pharmacies where you're able to access low-income medications for a certain fee. So that's an option to consider. Community health centers. If you decide to look for one of those places and do an internet search, use that specific term, community health center. Use that exact phrasing. And the best place to look for one of those organizations is on the website of the Department of Health and Human Services. And if you look around enough, you'll be able to find a place on there where you can look for low-cost health care and locate community health centers. But if you just do an inner search, remember that phrase, community health center. And you may find that you're able to access medical care on a sliding scale, and the co-payments could be very low compared to traditional medical services. So keep community health centers in mind. Are there some problems with these places? Yes, I would say they are. A lot of times they are operated by minority groups who do things in a minority way. I don't know how else to say it. They just do. For example, the biggest community health center group here in the El Paso area, I can't think of the name right away. I don't have it in front of me, so I can't think of it, but that is a Hispanic operated group. And so sometimes you'll find that community health centers are operated by minorities. There's kind of a different way of thinking that goes on there. I don't really have time to go into that and describe it, but a lot of times minority groups don't tend to see things in the way that other people do. And I'm hard-pressed to get specific and give you specific examples right now, but just know that a lot of times community health centers are operated by minorities, and you may encounter different ways of thinking there. A disadvantage to these community health centers is a lot of times is that they can be bureaucratic nightmares. Some of these community health centers have policies and procedures manuals like that thick. And a lot of times that's only one. A lot of times there are reams and reams of paperwork that describe how these places operate. So it can be extremely complicated if you don't do things exactly right. How would I suggest that you deal with a community health center? I'd suggest this. Make an appointment. First of all, you may want to call and see what do you have to do to become a patient at a community health center. Next thing is make an appointment as early as possible. The next thing is keep your appointment, and then the next thing is follow your medical provider's instructions explicitly. Cooperate with the doctors as best you can, and try to be as nice and courteous as you possibly can to the people at these community health centers. And you may find that you're able to get medication that you need, and that will handle the problem. You can get blood pressure medication, you can get medication for diabetes, but remember community health centers as an option. Now, an interesting thing about these community health centers is a lot of times they will provide care to people regardless of ability to pay. Sometimes people are provided with free care, whether they can pay or not. But here's an interesting thing. they don't like to advertise that sometimes. And a lot of times they'll have paid lackeys running around saying, we are not a free clinic, we are not a free clinic. And there is a copay, there's a $20 copay, and we want people to pay. And sometimes when you go there for an appointment, they will say, as soon as you get there and sign in, I need to collect your copay. And so people may sometimes feel pressured. Does this asking about the copay, do these repeated assertions that they're not a free clinic, does that discourage people from using their services? Well, what do you think? What do you think about that? Does this idea that community health centers that sometimes perpetrate that they are not free clinics, does that discourage people? I would say, in my opinion, yes, it certainly does discourage people. And you would think that these community health centers, the people that run them, would know that there are loads of people in the United States of America who are always in desperate need and legitimately do need health care. So I asked somebody one time, why do they go around saying we're not a free clinic if in fact they do provide free services sometimes? And the reason for that probably is this. They are huge bureaucracies, and most of the people who work there are paid to work there. They have a paid job. They have a large administrative staff. And the thing with community health centers sometimes is, if you've ever studied characteristics of bureaucracy, such as been written about by Max Weber and others, you'll find that characteristics of bureaucracies are that they tend to protect their empire. They protect their fiefdom. They protect their source of income. And a lot of times people in bureaucracies want to do that at all costs. Protect the organization, protect our fiefdom, protect our empire. And you can find that with these community health centers a lot of time, that even though free services are available to people who need it, they won't advertise the fact. They will sometimes attempt to conceal that fact. They will have paid lackeys running around and say, we are not a free clinic, we are not a free clinic. And I would guess the motivation that I can think of is, since everybody who works there gets paid and administrators get paid ridiculous salaries sometimes, I would think the reason they tell people they are not free clinics is that they just want to protect maybe the gravy train. Maybe they want to protect their organization. Bureaucracies and organizations tend to be self-protective. But in spite of that, remember that community health centers can be an option for low-income people. And you can get services based on a sliding scale depending on your income, and you may in fact be able to get free care if you've got no income at all or extremely low income. So community health center, remember that phrase, that can be an option for health care if you are financially distressed. Now there's a third option, and a lot of times this one works better for people who are economically or financially distressed. The third option are free clinics. Clinics that actually call themselves free clinics and that put it out there that free services are available. And eligibility for services through a free clinic depends on income. You'll need to be able to provide probably some kind of proof of income. But the great thing about free clinics is, for the most part, the people who work there are all volunteers. They volunteer their time. They just want to help people, and that's why they volunteer. And I've heard of places where a lot of well-known doctors volunteer, and well-known nurses who are known in the community, and retired doctors and nurses who want to stay active and want to be able to help people without working for pay. So those can be good options. And the thing about free clinics is, a lot of times you'll find that they are easier to deal with and a lot less bureaucratic compared to community health centers. So it would help you, if you're in financial distress, to just do an internet search on free clinics and see what free clinics are available near you. Now, unfortunately, there are not as many of those as there are community health centers. But if you can find free clinics, what you may be able to get is primary health care, not necessarily getting treated for broken bones or emergencies or similar situations to those, or arranged carpal tunnel surgery and similar things. You may not be able to do that, but at least you can get prescriptions written, medications to treat problems. So free clinics, where they are available, and unfortunately they're far too limited, but where they are available, they are a good option for a lot of people. So again, what are the three primary options for low-income people who need health care or uninsured people who need health care? First of all, there are hospital emergency rooms, and you may want to provide proof of your income later after you use those services. Then there are community health centers, and you'll want to provide proof of income there if possible. And more than likely, you'll get on a sliding scale based on your income, although a lot of them provide free services that they don't advertise. And to get access to those, you may just have to tell them your situation straight up and possibly document it. But you may actually be able to get free care through community health centers. But then there is the third option where they don't hide from the fact that they're free services. Free clinics don't hide the fact that you can get free services there. They're straight up honest about it. And those are in fact the best options for a lot of people. Hospital emergency rooms, community health centers, and free clinics. Another thing about community health centers, they get a lot of government money, and sometimes they take insurance too, and so this mixing of money and the fact that they have employees does contribute to bureaucracy a lot of times. But remember, with those, prove your income, make appointments in advance if possible, and be as cooperative as you can with the medical providers, and you may not run into problems with community health centers. Those are one option. And then there is the free clinic option, and you'll want to try to provide proof of income there, but you may find them easier to deal with than community health centers because they don't operate with the same level of bureaucracy, and it may be a better experience for you if you can use the free clinics. And those, for now, are the three primary options for people who need health care and are uninsured and are low income: hospital emergency rooms, community health centers, and free clinics. And in brief, that's the way it is. Thank you for your time. Have a great day.